Next, we'll review pinworm infestation. It is caused by nematode Enterobius vermicularis. This small white thread-like worm is approximately 1/3 to 1/2 an inch long. Pinworm infection flourishes in temperate zones worldwide. In the United States, it is the most common worm infestation. It most often develops in preschool-aged children and children in daycare centers. What are the major risk factors for pinworm infestation? Children at greatest risk live in crowded conditions, attend crowded daycare centers and schools, and have contact with contaminated toys, toilet seats, doorknobs, linens, underwear, and food. The process of infection with pinworms involves a specific cycle of events. It starts when the child either ingests or inhales pinworm eggs. After the eggs hatch in the upper intestine, the worms mature and migrate through the intestinal tract. The female pinworms come out of the anus at night and lay eggs in the perianal region. The infected child develops intense pruritus, scratches the rectal area, and then puts her fingers in her mouth. This common hand-to-mouth activity makes the child with pinworms prone to reinfection. Pinworm eggs can survive for 2 to 3 weeks, contaminating everything the infested child comes into contact with. Because pinworms are easily transmitted from person to person, ask parents or caretakers these questions about the child's environment. Is the child attending preschool or daycare? Where does she sleep? Does she share a bed with anyone else? Who else has close contact with the child? Are there any other people in the house who have the same symptoms? How long has the child or other family members experienced symptoms? Major signs and symptoms of pinworms are rectal itching and irritation, scratching of the perianal area, irritability and restlessness, sleeplessness, short attention span, bedwetting, weight loss, poor appetite, and vaginal itching when worms migrate into the vagina in girls. Pinworm infestations may be complicated by infections in the perianal area. Girls may develop urethritis, vaginitis, salpingitis, or pelvic peritonitis. The diagnosis of pinworms is usually based on the tape test, which can be conducted at home. Using a flashlight, parents can examine the perianal area 1 hour after the child has gone to sleep. The pinworms are easily identified. A tongue blade for the test by wrapping the cellophane tape, sticky side out, around one end of the tongue blade. Commercially prepared pinworm diagnostic tape is also available. The parents can conduct the test as soon as the child wakes up in the morning and before the child has a bowel movement or bath. The parent should firmly press the tape against the child's perianal area and then put the tongue blade into a glass jar or plastic bag. The specimen is then sent to the laboratory for microscopic examination and diagnosis of pinworms. Nursing diagnoses for pinworms include impaired tissue integrity related to pinworm infestation and scratching of the anal area, risk for injury related to scratching the anal area, and sleep pattern disturbance related to irritation from pinworm infestation. The goals of your care are to treat the child and family with medication, prevent recurrence and complications, and stop the spread of the infestation. Medications that are used to treat pinworms include mebendazole, trade name Vermox, and pyrantel pamoate, trade name Antiminth. Mebendazole is a medication of choice for eradicating pinworms. This drug has few side effects and it is a safe and effective chewable tablet. However, children under 2 years of age should not take mebendazole. If pyrantel pamoate is prescribed, warn parents that the drug stains vomitus and stools bright red. All household members must take the medication for pinworms. To prevent reinfestation, drug therapy should be repeated in 2 weeks. Finally, you'll teach parents some specific measures for preventing reinfection. Instruct them to wash all linens and clothes in hot water, to wash their hands thoroughly before eating and after using the bathroom, to clean the bathroom and toilet seat or diapering area daily, to keep the child's fingernails clean and short, and to discourage the child from nail biting and thumb sucking. It is also important to educate teachers at the child's daycare facility or school about pinworms and the need for treatment.